There was a question from Al Jazeera, but before we go online for Dr. Ann and Dr. Rosalind to answer these questions, let me add one. This one says, my name is Ellen Shikanda from the National Media Group in Kenya. My question is on the Hantavirus. So it's the same question. Hantavirus outbreak reported in cruise ship. Are we anticipating the cases to spread on land since we have already reported one case in Switzerland? What can African government do to prevent should we find cases in Africa? What does this outbreak tell us about the One Health approach and the pandemic agreement that is now dragging? These questions will go to our online Dr. Rosalind and Dr. Ann. Please, these two questions are for you.
Thank you, and good afternoon, everyone. And thank you for this important question. As you know, we are dealing now with an outbreak linked to a cruise ship starting from Argentina, going to the...
Yes, we can't hear you. Please unmute.
I am on mute. Can you hear me now? Can you?
We can hear you now.
Okay. So I say thank you so much for this important question in that moment that WHO, together with all partners in the member state, we are dealing with that outbreak starting in a cruise ship. This travel starting in Argentina more than 3 to 4 weeks ago. So WHO, we assess the situation, and actually based on all the evidence we have and the assessment that we conducted, so the risk is evaluated as a low at global level, as a medium in the ship, in the cruise ship, and also is a low and medium for Africa. So what was the situation? So far, we have 8 cases, linked to that outbreak. We have 3 deaths, unfortunately, and we have 1 case in Switzerland, as the journalist mentioned. So what can member states do in terms of that? So WHO, we release, a brief for member states where we really recommend that member states reinforce surveillance, also laboratory system and clinical care. So for hantavirus, we don't have a precise treatment for now. It's really to take symptomatic care and also to give very good clinical care to the patient. So we don't have a specific drugs that can treat rotavirus and so forth. Other information also that we can share is that at the country level where we have the link with the outbreaks so far in South Africa, we are supporting the member state to conduct contact tracing. So far, we have 69 contact that are under close monitoring in case there is a symptom, so we can be quick. So this is also a recommendation to member states to be vigilant, to increase the vigilance, to increase the surveillance system, the clinical care, and also the IPC. So in Cape Verde, I will leave my colleague Ann, who is the WO in Cape Verde, to say what she's doing, supporting the member state in Cape Verde. But I can say that at regional level and global level, so what that outbreak tell us? That outbreak tell us that for more than ever, the world needs WHO. So it has been only through that focal point, IHR focal point, International Health Regulation focal point, that this outbreak has been detected. There is no really other organization that can put all the world together in that one. You know, something started in Argentina, coming to Africa, now it's in linked to Europe, in Switzerland. We have more than 23 nationality in that ship. So that's really important to know that we need the global arena of public health where we can have all the member states together. This network of national a national focal point for international health regulation has been key in detecting that outbreak, and we are continue to manage that outbreak together with all the member states involved. So let me stop there and give the Ann so she can add more information regarding how we are supporting the member state of Cape Verde and to going forward with that outbreak. Thank you, Ann, over to you.
So, Dr. Roslin, I can't agree with you more. This WHO has, from the start, coordinated a very time-sensitive and multi-country response under the international health regulations, really ensuring patient care and then protect populations. And so all those interventions that we've done is giving guidance to the ship operator on how to manage the health of the passengers on board, medical evacuations and treatment. 3 patients flew out 2 hours ago here from Cabo Verde. They were medically stable. They were going to Netherlands for future care. So what now is going on is international contact tracing, as Dr. Roslin was saying. We have been taking samples of the clinical patients on board, and they're being analyzed right now. And I think I'm getting information by the end of the day at Institut Pasteur in Dakar. Of course, we've also doing risk assessment and information to all of those countries involved through the IHR channels. The boat that is still currently in the harbor of Cabo Verde in Praia will be leaving in 2 hours. On the boat right now, there's been a reinforcement. One medical doctor from WHO, who's also an epidemiology specialist, will be taking care of if there will be more cases on board, but also doing epidemiological investigations together with other international colleagues on board.
Maybe,
and Dr. Roslin, just in this before we take the closing remark from Dr. Janabi, what can you tell us about the strain confirmed in South Africa and Switzerland? Is the variant more transmissible or a new variant? Plans
so far,
to evaluate the German woman whose body is still on the ship. So these are questions to Dr. Ann and Dr. Roslin. Thank you.
Thank you again for the question. So far, we have the same virus confirmed. So in South Africa, it was the Hantavirus and this, type. And it's also, we just received at the time I'm talking with you, the result from IPD in Pasteur Institute of Dakar. As I mentioned, the WHO, which is a collaborating center of WHO, and the sample collected from Cabo Verde was sent to Dakar yesterday. So today we already have the result, and they confirm the same, virus, the 3. So far, I think we can, with cautious say that the cases are linked to the same outbreak, because it's the same case, the same outbreak, the same virus also confirmed in Switzerland, in the patient evacuated in South Africa, and also in the patient that where the sample were collected also in Cabo Verde. So far, we can say with the lab result that the cases are linked to the same outbreaks. But however, we are still continue conducting more investigation. As you know, we are pending for more, data, epidemiological data. So we've more with more to confirm totally, the outbreaks. But so far, all the cases have the same lab result. Over to you, Ann.
I also just got the news from Institut Pasteur that you had the positive for Hantavirus as well. So this Andes type is the one which has shown before to be able to spread human to human more than other strains. So this was However, we must say that the risk is very low still. Even on the boat, there are 147 people that was on that boat, and we now, as we said, had 8 people who have been showing signs. There needs to be, even with this Andes, a close contact between sharing cabin or being a couple or something really being close to be able to spread the disease from one or the other.
Thank you very much. We'll take the closing remarks from Dr. Janabi. But before that, so you come here to wrap up. But there is one question from a Minister of Health in Africa who is asking whether is Africa directly involved in this. So please, as you are wrapping up, please touch on this. Thank you very much.
Thank you, moderator. So colleagues, we were in workforce, now we're in Hunter. So colleagues, what you have heard, my colleagues, the Hantavirus event is a reminder that even rare threats can test our systems, especially in a world of increasing mobility and human-animal interaction. So while the risk remains low, the lesson is very clear. Preparedness depends on people. So our strongest defense is not only on surveillance and on the laboratories, it is a trained, motivated, and retained health workforce. Without skilled frontline workers, even the best strategies cannot be implemented. So as we leave here, let us commit to 3 priorities. Plan better by protecting training investments, train smarter using scalable and practical approaches, and retain our talent through clear career pathways and supportive working environments. If we get this right, not responding to Hantavirus, we are strengthening Africa health security for every threat ahead. Is Africa directly involved in this Hantavirus incidences? Yes. Although this ship started from South America in Argentina, it's heading, as you heard, it's heading to West Africa in Cape Verde. The critical cases were treated in our member state, South Africa, in ICU. So the bottom line just tells you, multilateralism, the WHO are very pillars of health in this globe we live today. So we need to work together. No single country can achieve without being together as family. As usual, as our DG always says, there's no one who is safe, or there's no single country will be safe if one country is not safe. I thank you for your attention. Thank you.
Thank you very much, Honorable Minister, for here. Please, it's your time for a closing remarks. Yes, please.
I don't think I have anything useful to add. Just to use this opportunity to thank Professor Janabi and your representatives for choosing Ghana as the venue for this very important forum. And we'll continue to assure you that we in Ghana will continue to be the advocates of the health sovereignty, and we will also, leave an example. They say that. Thank you very much.
Thank you very much, our panelists. Thank you, Dr. Janabi. Thanks, Dr. Nyeng. Thank you very much, Dr. Branca, and thank you, Honorable Minister of Health. To our Honorable Deputy Minister, we're grateful. Minister, thanks for making this happen. We'll continue to Friday. We'll be here till Friday. Thank you very much. Our online journalists, we are grateful to all of you, to everybody who made this possible. God bless us all. Thank you.